This method is tried and true with anyone I've ever helped with CMP exams, and I'm really hoping this resonates with you.
Whiskey 9 Yankee 7 November Golf, over.
Something we can all agree on are CMP examiners aren't the best. And there's only one saving grace a veteran has going for them, and that's medical evidence. In order for this method to work, you have to have medical evidence, plain and simple. Here's the method. Disability plus timeline plus continuity equals service connection. I'm going to show you a scenario and then answer some CMP questions using this method. Scenario is you just left the Marine Corps or whatever service in 2019. In your service treatment records, you have a one-line complaint about migraines back in 2012 and a one-line complaint about lower back pain. Since 2019, you've had appointments with your primary care at the VA or private, whichever you prefer, and you've talked to them about your migraines and your back pain. It's now 2024 and you want to submit a VA claim, so 5 years have gone by. The examiner will start to ask you questions like, you're here for migraines, how often do you get them? My answer would look like this. I started having migraines after my Afghan deployment in 2012, and I went to medical for them because they were pretty severe. I've had them ever since and just sort of dealt with them for years. Over the past few years, they've been increasingly worse, and I've been taking sumatriptan, about 100 milligrams, about 3-4 times per month, and I got that from my VA healthcare provider. That answer is a billion times better than just saying this. I get migraines about 3-4 times a month. Something veterans absolutely need to know through and through is your medical evidence. Know your medical evidence. Know what your service treatment records look like, have dates, have times, have events, know what your VA medical records look like, so when you're asked a question, you can use this disability plus this timeline. I went here, I went there, here's my continuity, and I'm telling you, it will be service connected. 9 times out of 10, and I would probably say 9.9 times out of 10, when a veteran has been denied, it's due to a lack of in-service events or a lack of a current diagnosis. And, now hear me out about this, okay? Every single time a veteran tells me that they had both and they submitted an evidence-based claim, and I ask to look at their decision letters, when I'm reading the reason for denial, I'm telling you almost every single time, an overwhelmingly majority of the time, that veteran is missing the in-service events or worse, the current diagnosis. There is absolutely no reason any veteran should be submitting any claim without a current diagnosis or, at a minimum, documented symptoms that would lead an examiner to give a diagnosis for VA rating purposes.